Hi friends, in this video I will be covering various causes of depression and how various factors make an individual more likely to develop a depressive episode. Human brain, the command center, is one of the most beautiful and amazing structures in the human body. It has various functions. Different regions of the brain control various functions. For example, how our body moves, how we recognize various sensations. And human brain is also center for our thoughts, our emotions and our behavior. Now, these various regions of the brain which regulate so many important functions in the body are beautifully connected by various circuits. It's almost similar to computer, but definitely a more complicated one. How information passes from one part of the brain to another part, these are by few chemicals. These chemicals are called neurotransmitters. Whenever there is any problem in the structure of the brain or function, that is these circuits connecting various regions, or any problem in the neurotransmitter, that is when depression occurs. Genes and genetics, the most trending subject in medical science currently. So these genes are the ones that regulate almost everything that happens in our body. It is responsible for synthesis of all our hormones, the neurotransmitters that I spoke to you about and whatnot. So what has been identified is that whenever there is some problem with these genes, it usually comes in hereditary basis. That can cause depression, or rather it can increase the susceptibility for an episode to happen. Into stress and depression. Everybody knows stress and depression are associated, but why and how? Whenever there is any stress, it could be physical, emotional or any stress, what exactly happens in our body is there is release of stress hormones. These stress hormones go and act on the brain to cause various changes in whatever I mentioned before, structure, function and etc. Any chronic stress, that is stress which lasts for a long time, is known to cause changes in the brain. Especially in these children who have developing brain, they are just developing. In them, any form of stress, like say any physical abuse, emotional abuse, it just may not be you scolding the child, even neglect of the child can cause stress, and even sexual abuse. All these things are known to have lot of impact on developing human brain. Also, these stress hormones can cause something called epigenetic changes. Now what are these? These are the changes which can change the functioning of the gene. So in all these ways, stress can predispose to depression. Whenever a patient comes to us with depression, we make sure that we ask that person about the childhood. Why do we do so? Childhood is something which is very important for development of good mental health. Okay, there is something called attachment. What is attachment? Attachment is a bond which forms between the child and a primary caregiver. This caregiver need not always be mother. It could be mother, father, grandfather, any consistent caregiver. Okay, so if there is secure attachment means the child feels very safe. The child feels that whatever bad happens to me, this caregiver will make sure that bad thing disappears. And I can always explore the world because this caregiver is always with me when something bad happens. So this secure attachment is very important for a good mental health when the child becomes adult. So whenever this secure attachment is not there, it is known to predispose to depression. Medical comorbidities. This is something very important when it comes to depression. Many medical illnesses have a bidirectional relationship with depression. Say diabetes, cancer, hypertension and thyroid disorders, all these are associated with depression. Even neurological illnesses like say Alzheimer's disease, Parkinson's disease, post-stroke, all these things are predisposition for depression. It is known that sometimes in Parkinson's disease, even before the classic symptoms of Parkinson's like tremors and all appear, sometimes depression occurs before all these things. Next one common important factor is substance use. Any substance use for that matter, especially say alcohol, cannabis, this prolonged use of these substances known to cause depression. Even some of the medications that we use to treat other medical illnesses can also lead to depression. Now I told you about stress, okay? When it comes to stress, usually people think, negative life events can cause depression. In negative life events, by which I mean death of a loved one, or loss of job, loss of property, or failing in exams, love failure, and all these things can be classified as negative life event. What most of them don't know is that even positive life events can be a predisposing factor. By positive life event, I mean something like, say, promotion, childbirth, marriage. All these things can also be predisposition. Now you may wonder why it's such a happy thing to happen to you. But any change, it may be positive or negative, it demands lot of adaptation from our body, and that is when the stress hormones are released and the same changes which I had mentioned before happens. Now coming to few psychological theories of depression. I tell you about one experiment. It may seem very cruel to you, but then I have to tell so that you'll understand the concept. So what they did was, in the cage they kept one animal. There was no escape from that cage. Then they started giving electric shocks. So initially that animal tried a lot to escape, just wanted to leave from that cage. But then there's no escape available, right? So after repeated such attempts, what happens is that the animal just doesn't do anything. Even when you give the shock, the animal just stays by itself, in the corner, very apathetic, not bothered about anything. This could be explanatory model for depression also. This concept is called learned helplessness. So when a person, he keeps facing stresses in life, he tries a lot to, get away from that, but he just is not able to succeed in it. So when this continues happening in his life, that is when depression occurs. This is one of the old theories, may be true in some of the cases. Then coming to errors of thinking. We all have different ways of thinking. There are some known errors when it comes to depression, which are known as cognitive errors. I'll give you a few examples. First thing is called personalization. Imagine a colleague of yours is just walking, pass by, and then he does not recognize you, or he does not notice you, and he just passes without even looking at you or greeting at you. Actually, the colleague may be just, bothered or preoccupied by his own thoughts, and he may be disturbed by something, so he has not greeted you. But then you start thinking, oh, maybe that person does not like me, I am not lovable, I am not worthy of his attention, that is why he has not greeted me. This is called personalization. That is, there are so many external events happening around you, but then you don't personalize it. One more cognitive error is something called maximization. That is, I'll give you one example. There's one exam. You have scored very good in most of the subjects. In one subject, you've got some C grade or something. So what you do is just focus your attention on that particular subject and tell that, okay, I'm not worthy, I'm such a big failure in my life and whatnot. So that is maximizing trivial things. So the vice versa of it is called minimization. Like this, there are different cognitive errors. So if a person kind of tends to use these errors more often in life, even that could be predisposition for depression. Some personality factors can also make a person more vulnerable to develop depression. Other than all this, depending on various phases of life, there can be some other extra causes. For example, postpartum period is one of the most common risk factor for developing depression. One more is in elderly. Whenever there are vascular risk factors like diabetes and hypertension, especially in elderly, they can cause some changes in the vessels in the brain. Even that can predispose to depression. I have tried to cover almost all factors which can make a person vulnerable for depression. I have tried to make it very simple and conceptual. If you have any doubts, feel free to leave them in the comment box. I will reply for it definitely. If you like the video, please share it with your friends and subscribe my channel for further such similar videos. My next video would be on various treatment options available for depression. Thank you. Have a great day.